What tests are used to diagnose Parkinson's in its early stages? Diagnosing Parkinson's disease in its early stages can be quite challenging. There is no single test that can confirm the disease definitively. Instead, doctors relying on a combination of clinical evaluations and tests. A neurologist, often a specialist in movement disorders, plays a key role in this process. They will assess your medical history, symptoms, and conduct a neurological examination. One of the primary methods for diagnosis is a clinical evaluation. Doctors look for specific motor symptoms. Bradykinesia, which is the slowness of movement, is a key symptom. Along with this, the presence of a resting tremor, muscle rigidity, or postural instability can help in making a diagnosis. This clinical approach is vital because many symptoms of Parkinson's can overlap with other conditions. Imaging tests also play a role in the diagnostic process. One important test is the dopamine transporter scan. This specialized imaging test visualizes dopamine nerve endings in the brain. It helps confirm a deficiency of dopamine, which is typical in Parkinson's disease. However, it cannot differentiate Parkinson's from other conditions that also cause dopamine loss. Another imaging test used is magnetic resonance imaging. While it does not diagnose Parkinson's directly, it is useful for ruling out other neurological issues that may mimic Parkinson's symptoms, such as strokes or tumors. Laboratory tests are performed to exclude other disorders that could cause similar symptoms. Emerging tests are being researched, such as the alpha-synuclein seeding amplification assay on cerebrospinal fluid. This test detects abnormal proteins associated with Parkinson's and shows promise for early detection, but it is still under investigation and not widely available. Skin biopsies and cerebrospinal fluid tests are also being studied as potential diagnostic tools, but they are not yet standard practice. Researchers are looking into blood-based biomarkers that could detect early Parkinson's. These tests might measure mitochondrial DNA damage or abnormalities in alpha-synuclein. While these tests are still experimental, they could allow for earlier diagnosis before significant neurological damage occurs. In summary, diagnosing early-stage Parkinson's disease relies on a careful clinical assessment, supported by imaging and laboratory tests, to rule out other conditions. While new biomarker tests are promising, they are not yet part of routine clinical practice. Given that early symptoms can be subtle and overlap with other disorders, consulting a movement disorder specialist is often recommended for a more accurate diagnosis. If you suspect you may have Parkinson's, it is important to seek evaluation from qualified healthcare professionals for a personalized assessment.